very grateful for the opportunity to be able to be with you this morning and be able to share what I think is very, very important information, and I hope will be of real practical value to you. And what we're going to focus on in this particular session is the whole issue of COVID, and now we're coming into the seasonal flu, and we want to really understand how we can best protect ourselves and our family. So this is of concern, of course, and I do always say that any kind of recommendations you may get from this presentation, it's always best to kind of get the advice of your own personal doctor before you implement anything. But as we know from all the challenges around the COVID situation, that there's a tremendous amount of effort and resources being devoted to finding the best therapeutics, the best treatments, that's to say, the possibility of safe and effective vaccines. This is very much on the front burner, so to speak. And everyone is kind of thinking about that and hopeful about that. And at the same time, what we don't really hear that much about is what we can really do ourselves to be able to strengthen and fortify our immune system. And this turns out to be a very, very important factor in being able to protect ourselves and our families, is learning what we can actually do ourselves to be able to be in a better position to be able to kind of deal with exposure so that we don't become seriously infected, or if we do get infected with COVID or the seasonal flu, that we get a mild case, that we don't have to end up, a serious situation involving a hospital or ventilators, that kind of thing. And so the information coming from the CDC is really clarifying that, well, like for example, in April, they were saying that 90% of the COVID hospitalized patients had some type of comorbid, that means coexisting condition, like heart disease or being overweight or diabetes, something like that. And then just last month, in August, they now say that 94% of the deaths from COVID have, again, some type of comorbid condition. So we can see that being able to be in as healthy a state as we can is certainly like a foundation for anything that we could do ourselves. And coming out of the journal Cell Metabolism, again, just in April, they said regarding COVID-19, one thing is very clear: the people who are having the hardest time with this virus all have one thing in common: they have extremely poor glucose control. So what we're talking about here is the level of blood sugar in the blood, and having a good level and having it under good control. This is a vitally important factor in terms of being able to protect us from COVID. They said survival is upwards at close to 99% for people that had well-controlled blood glucose, whereas those who were really in trouble and even died from COVID, essentially they had very poorly controlled blood glucose. So this really relates to the whole issue when we talk about blood glucose. This really relates to the whole issue of what we refer to as metabolism. Metabolism is the cellular energy that is created through biochemical reactions at the cellular level. We can say that metabolism is the chemical processes that occur within a living organism in order to maintain life. And research coming out now from, for example, here at the Gillings School of Global Public Health in November several years ago, they clarified that only 12% of the American adults are metabolically healthy. This means 88% of American adults are not metabolically healthy, and close to 50% are actually either diabetic or pre-diabetic. That includes children. So we can see that metabolic health is a critical factor. Controlling and managing properly the blood sugar, this is very, very important in terms of having a robust and effective immune system. But unfortunately, we know that things seem to be kind of, in spite of our wonderful healthcare system, that there are many indices of the health of a population where we see that we're in some serious difficulty. When I went to medical school, Columbia University, graduated 50 years ago, type 2 diabetes was considered adult onset. You just never saw it in children, where now we have 9, 10, 11-year-olds with type 2 diabetes, all the problems of being overweight, 2 out of 3 Americans, including children. And so the key for metabolic health is to balance the blood sugar, to have good blood sugar control, to be eating a healthy anti-inflammatory diet, certain supplements that we'll talk a little bit about as we move forward here, and other lifestyle factors for health and vitality, a regular exercise program, restful sleep, clean water and air, sunlight. And so I want to be able to focus today specifically on one particular nutrient for cellular metabolism. Again, there are many factors, including our diet and other lifestyle factors, but for today I want to be able to focus especially on vitamin D, because there's more and more research now coming out as a result of COVID about the impact of vitamin D. Now, most of us, when we hear about vitamin D, we understand that it's good for our bones. It's good for maintaining strong, healthy bones. But it also does help with blood sugar control. It's vitally important for maintaining a good level of blood sugar in the blood. It also reduces cancer risk, which may not be known to a lot of people, but actually vitamin D is definitely a way to reduce the risk of cancer. And it affects our mood, depression, anxiety. Even studies now talking about the impact of vitamin D on adolescents at risk and how it helps them with to reduce the risk of violence and other antisocial behaviors. And it improves brain function, reduces the risk of dementia, improves brain and cognitive function. This is an amazing assortment of very diverse benefits that come from vitamin D. Actually, vitamin D is not really a vitamin. It's more of a hormone. When it was first discovered, they kind of thought it was like a hormone. They thought it was more like a vitamin. But actually, as we've understood over these many decades, we now realize that it's not really so much a vitamin as it is a hormone with many diverse benefits. And one of the most important is that it fortifies the immune system. So when we look at many diverse health conditions and vitamin D levels, you can see from this chart here that many different health conditions, as we increase the level of vitamin D in the blood, what they call nanograms per milliliter of vitamin D, as that increases, there's a decrease in these various problems, and we're adding more and more to this list. So how does vitamin D particularly fortify the immune system? How does it particularly fortify the immune system? Well, vitamin D is what we call an immune system modulator. It means that it balances 2 different types of what are called cytokines. These are the things we hear about with those folks in the hospital from COVID who are going through what is called a cytokine storm. But there are different kinds of cytokines. Some of them are pro-inflammatory. They will cause inflammation, like the problems in the hospital with COVID, that kind of thing. But there's also anti-inflammatory cytokines. So the key is in balancing the pro and the anti-cytokines. And vitamin D does this by reducing the pro-inflammatory cytokine production in the cells and increasing the anti-inflammatory cytokine production. And there's an enormous amount of research with regard to this. Now, as we're getting more and more data, more and more information about the COVID experience around the world, we see that the epidemic of what really is a worldwide deficiency of vitamin D has collided with the COVID-19 pandemic And this is basically kind of making the situation worse, because the association of vitamin D deficiency and metabolic and immune system problems is becoming more and more clear. We see that as the vitamin D concentration in this chart, as the vitamin D concentration in the blood increases, then the rates of death of COVID are dramatically declining. Now this is, we can't really say that this is a proof of causality. At this point it's association. But it's so obvious that there's an association between increasing the vitamin D and a decline in the death rate that we have to pay attention to this. Unfortunately, about 40% of our population is vitamin D deficient, as defined by a blood level of below 20 nanograms per ml. It's a little confusing because there's another way of measuring vitamin D, particularly from Europe and other countries. But we have to be talking about nanograms per ml, which is basically the way that we characterize vitamin D levels in the United States. And we say that 40% of vitamin D deficient, if their blood level of vitamin D nanograms per ml is below 20. But actually below 20 would mean basically being susceptible to rickets, the vitamin D deficiency that we've known about for 100 years. So when we consider not just vitamin D deficiency, but when we consider vitamin D insufficiency, meaning we're not necessarily at the very low level, but we're not getting the adequate amounts that we really need to protect, because the sufficient level of vitamin C would be, vitamin D would be at least 40 nanograms per ml. That means it's twice what is considered to be necessary to prevent rickets. So we want to at least have twice the amount of vitamin D that is basically being told is like the minimum level necessary. And unfortunately, this vitamin D deficiency, this is affecting many, many children and teens. These things are being measured by the Centers for Disease Control. And so we see the children are at risk. And as the vitamin deficiency is a risk factor for COVID hospitalization, disease severity, and ICU admissions, meaning, again, all of these signs of an association between insufficient or deficient vitamin D, we see the impact in terms of the severity for COVID as an infection. We want to have either no infection with COVID or we want to have a mild infection, but we certainly don't want to have to be in a severe infection requiring hospitalization or any of that. And this is from Orthomolecular Medicine News Service, again just recently in June. Research suggesting that a person's risk of developing and dying from COVID is significantly lower when you achieve an adequate vitamin D level of at least 30 nanograms. So at least 30, but ideally even 40, even more for some other medical conditions is what we want to achieve in order to be able to really benefit our system in terms of the risk of COVID. Look at this Indonesian study that showed with a vitamin D level of less than 20, the mortality rate was 98.8% compared to 4.1% when people had levels above 30. So there's information coming from all over the world that's again talking about the association between having a more robust immune system, being able to deal with COVID more effectively. And as a consequence of that, we can say this association means, from a practical point of view, we want to really be able to understand our vitamin D levels and act accordingly. For countries in Europe, the probability of developing COVID and of dying from it is negatively correlated with mean population vitamin D status. What it means is, once again, what the charts are saying, as the vitamin D level is improving, increasing, the deaths per 1 million population is diminishing in very dramatic terms from Europe. So it's not just about COVID. Of course, we have our concern right now, especially about COVID, but we're moving into the flu season. And so there's a lot of research coming out now that's talking about the evidence that vitamin D supplementation can reduce the risk of both influenza and COVID-19. This was from the journal Nutrients in April. It's recommending that people at risk of flu or COVID consider taking 10,000 IUs of vitamin D3 for a few weeks to rapidly raise the level and then to be able to bring it down to a more maintenance level. So again, if you're seriously low or if you're really moving into a situation where you might be exposed to either the flu or to COVID, well then you, on the basis of testing your vitamin D level, you might have to take a lot more for a few weeks and then bring it down to a more maintenance level. So here in the British Journal of Nutrition, May 2020, all of this recent research, they're saying preventive vitamin D supplementation and or food fortification might reasonably serve as a very convenient and incomparable, invaluable adjunct therapy for these two worldwide public health problems alike, vitamin D deficiency and also the pandemic of coronavirus. So why do we have this deficiency of so many of our people in a country as advanced and with such an advanced medical system as we have here in the United States? Well, one thing is because we are very concerned about skin cancer, and so people are more or less limiting their exposure to the sun, because the sun creates vitamin D through acting on forms of, actually it's a form of cholesterol, it's related to cholesterol in the skin forming vitamin D, and when people don't get enough sun exposure or they're using a lot of sunscreens when they are exposed to the sun, this is one reason why the percent of vitamin D is so high in terms of deficiency. Because with these sun blocks, 97% of the vitamin D is blocked. Also, aging skin is another factor. The average 70-year-old person creates only 25% of the vitamin D level of a 20-year-old. Then certain kinds of restrictive diets, which might limit certain foods which might be higher, particularly certain animal products. These more restrictive diets, while some people have strong reasons for advocating them, it does affect the level of vitamin D. And even, again, some of these comorbid conditions, such as being overweight. Skin color makes a difference too, because people of color, because they have the pigmentation in the skin to protect from excessive sun exposure, then you can see that, for example, Black and African American, they have even lower vitamin D levels. Only 16% of Black adults have sufficient levels of vitamin D, only 16%. So this is definitely something that we have to address within our Black communities. This is all from the CDC. So unless you're spending all your time at the beach and eating 30 ounces of wild salmon a day or downing 10 tablespoons of cod liver oil a day, vitamin D supplementation is really necessary. And the good news is that it's safe, it's affordable, and easy to do. I mean, it's a small gel cap that really can give you what you need. So there's some additional research here coming from a journal, Anti-Cancer Research, and there's a lot. This is just one particular research study. There's a lot out there of the levels of vitamin D needed to reduce cancer risk. This was actually 9 years ago. Even though the official recommendations on vitamin D, again, to prevent rickets, which is the lowest level of sufficiency, just above deficiency, would be just 600 international units of vitamin D a day, just 600, 800 for those over 70. To avoid being below that 20 level. But actually, the research coming in, for example, here at the University of California, San Diego School of Medicine, other university studies, they're saying that the range should be maybe 8 to 10 times more than what is being recommended at the low level to prevent rickets in order to be able to markedly reduce by 50%, by half, the risk of breast cancer, colon cancer, MS, type 1, type 2 diabetes. This is absolutely stunning. You're talking about levels 8 to 10 times above what is being officially recommended at the low level, giving a 50% reduction in the risk of some of these major health challenges that our society is facing. And in fact, they're questioning some of the research that led to the low levels of recommendation. Here they found that the vitamin D, what's called the RDA, the recommended daily allowance for vitamin D, underestimated the need by a factor of 10. So it means that even some of the research is being called into question. And Dr. Heaney, medical doctor at Creighton University, he said, quote, "We call for the Institute of Medicine, the National Science authorities, and all public health authorities concerned with transmitting accurate nutritional information to the public to designate as the RDA a value of approximately 7,000 international units today from all sources." So I'm not recommending that you necessarily take that much. I'm not recommending that at all. What I'm trying to do is put out there for your consideration some of the research, some of what major vitamin D researchers are saying, so that you're in a position then to be able to discuss this with your own doctor to find what would be the recommendation that's in your best interest. But you see, we're talking about like 8 to 10 times the amount which is being recommended at like 600, or if you're over 70, 800 international units. So most scientists who are actively working with vitamin D, means particularly the researchers that are focused on vitamin D research, they believe that 40 to 60 nanograms per ml, not the 20 at the low end, but 40 to 60 is the appropriate target by reducing by 50% those major health challenges that we spoke about. And according to the National Health and Nutrition Examination Survey, which is done by the Centers for Disease Control, only 10% of the US population have levels in this range, which is achieved by supplementing 10 times the amount being recommended by the National Institutes of Health at the lower end. So current estimates are that 90% of Americans are living with either a vitamin D deficiency or insufficiency. And so this is why we want to be able to really take some action steps to be able to enhance and fortify our immune system to protect us against the flu, against COVID infection. And the best way to do this, the most ideal way to do this, is to have your vitamin D checked by your doctor. It's a test that can give you immediately an understanding of where you are. Are you down there at the low level of even what's considered normal at 20, 25? Or are you up higher at that 30 or even 40, 60? And when you get up to that range, you're already talking about reducing the risk of very serious health challenges beyond the flu, beyond COVID. It really, for something that's just so easy to do every day, a little gel cap every day. So you want to discuss with your doctor about supplementing with 4 to 5,000 units, or even higher at first if your vitamin D level is very low. You want to use vitamin D3, the only active form of vitamin D that you can take in orally, vitamin D3. And just in conclusion here, this is a product that's available in many kind of nutrition and supplement stores, places like Whole Foods and Food and Thought, Seed to Table, others are around, but this product available through Amazon, it's called Reboost Zinc Plus 10. And you can use this not only if you're dealing with the flu, but actually during the flu season, certain of those ingredients have been used in Europe widely. Taking one of these chewable tablets every week during the flu season has really had a very significant impact in terms of reducing the flu, the seasonal flu. And then if you were to get a cold or a flu, you could take it more frequently. But once a week, this could be of real help. So that's the information I want to share today. I know that there's a little bit here that was kind of on the technical side, the numbers, nanograms per ml, milliliter. But I think the point is to have you aware of the fact that, most people, I've been advocating for, as a medical doctor in practice, I've been advocating for vitamin D for years, but I never realized how low so many people's vitamin D level is. And with the COVID research now coming in with vitamin D, we understand that we really need substantially higher levels in order to be able to get the full benefit of it. Again, that recommended level of 600 international units per day is just to kind of prevent rickets. But there's the issue of insufficiency as well as deficiency. So I hope that this has been of practical value for you. Have your vitamin D checked. Consider at least 4,000 or 5,000 international units on the basis of your conversation with your own doctor. And that's how I'd like to conclude our presentation today. If there are any questions or comments, I would certainly welcome that. But I wish you all the very, very best. Good health for you and your family. Thank you.